Next up, we have Dr. Lindsey Martin with Advanced Bionics.
Good morning, everyone. My name is Lindsey Martin. I'm with Advanced Bionics, and I'm a clinical specialist here in Florida. So today we're going to be talking about powerful experiences with our Marvel CI, and also because a lot of you in the room are hearing aid providers and not cochlear implant providers, we're going to talk about some technologies you can use along the continuum of care to help your patients. So Allie did a really nice job earlier laying out all of the Phonak technology available for patients along the continuum of care. From normal hearing to mild to moderate, there are lots of options available. And when we get to the severe to profound range, a new option that you see on the list there is the NAIDA Link Marvel. So that is a dedicated bimodal hearing aid from Phonak that works with the Advanced Bionics Marvel cochlear implant. When patients get into the range of needing electrical stimulation, we are going to talk to them about a Marvel cochlear implant, as well as Roger technology, or some of these patients may decide not to be implanted, and a cross would be appropriate for that other ear. So along the continuum of care, when we talk specifically about the severe to profound hearing loss, patients, again, may be referred for a cochlear implant evaluation, and depending on whether or not they want to be implanted, their audiologist may fit them with a NAIDA Link Marvel pair of hearing aids, and that allows them flexibility along the continuum so that when they become implant candidates or when they decide to take that first step and get implanted, they can use their hearing aid that they've already purchased to work in tandem with the CI. So this is really where the Phonak and AB technology overlaps and shows the full portfolio. And of course, some of these patients will become bilateral CI users, and at that point, this picture is depicting someone wearing Marvel CI for both ears. So we know the benefits of bimodal hearing, but just to review them with you, it's improved speech understanding for quiet and noise, less listening effort, improved music appreciation with better access to low frequencies, and improved sound awareness. But just bimodal isn't enough. So if you have a CI user, just fitting them with any hearing aid on the other side is not going to be appropriate or easy for them. We want them to feel as balanced as possible. So in the past, we know that a bimodal fitting could be in 2 different softwares. It may take the audiologist a long time with lots of different steps for the patient. The emphasis was on the 1 to 4 kHz range, but now we know that amplifying the low frequencies is really one of the most beneficial parts of bimodal fitting. And there used to be differences in the way that the 2 devices behave together. So the hearing aid and the CI operated differently with automatic gain control and differences in loudness growth. So Phonak and AB introduced the solution, the Marvel Link hearing aid and the Marvel CI. And in the Marvel Link hearing aid, we have a fitting formula called the Adaptive Phonak Digital Bimodal Fitting Formula. We refer to it as BFF at AB. So what it does is it aligns the frequency response of both the hearing aid and the CI so that they sound more balanced for the patient. Because if you think about it, electric input on one ear and acoustic input on the other ear will never sound exactly the same. So by aligning the frequency response, the loudness growth, and the dynamic behavior, we can make it more natural for the patient. Looking at a study comparing the BFF, you see it on the left in each column labeled APDB. We compare it to NAL and the patient's incoming set of hearing aids. And we're looking at AZ biosentences here for how many sentences the patient could understand. And when we look at quiet, there still is a significant difference with the bimodal fitting formula. And then moving into the middle column, which is noise, a noise condition at 0 dB SNR, there is an even more significant difference with the bimodal fitting formula as compared to the other 2 devices. And then moving into a -5 SNR, you can see there's still a statistically significant difference. So patients are performing the best with the bimodal fitting formula. And they're doing this through the use of AutoSense. So Allie talked about this a bit, but it's a scene classifier made by Phonak, which samples the sound around the patient multiple times every second. And we want these patients to be able to go into background noise or into a place with music without having to change programs. So as you can see on the screen, there's exclusive programs and blending programs that work in tandem for a patient who's transitioning between different environments throughout their day. So our competitors lump scene classification into 5 or 6 different environments, where AutoSense can provide over 200 different distinct listening settings. This is a study that looked at adult cochlear implant users across a variety of centers, and it compared our old processor, the Q90, which some of you may have worked with. It's shown in the blue, and it's compared to our Marvel processor that's available today. So in quiet, you can see that the Marvel and the Q90 perform about the same, but when you move into a noisy situation, the patients outperformed the Q90 group when they were wearing Marvel and AutoSense. And then to take it a step further, when we compare Marvel to itself using omnidirectional and AutoSense, you can see there's a big improvement when patients switch to the AutoSense automatic programming. And there's a quote from a patient here about their experience, and we've really seen with these upgrades that there is really a jaw-drop moment when we upgrade from Q90 to Marvel. So that was looking at adults, but what about our pediatric population? There's a current study underway at Nationwide Children's Hospital that's looking at the classifier-based noise management for speech understanding and noise for cochlear implant users. So this has never been looked at with CI users. Historically, we always have said, patients can't benefit from noise management systems if they're pediatrics, right? There has been this omnidirectional push for peds. But what we found so far in the preliminary data, super exciting. So this is on AZ Biosentences. When patients are using AutoSense in noise, at a 0 dB signal-to-noise ratio, we see a 21% improvement in their speech understanding. And then in even more difficult noise, at a negative 5 dB SNR, we see a 46% improvement for pediatrics. So just imagine a patient who used to understand 50% of the speech in their classroom is now able to understand 96%. So this is really impactful for those peds. And they're achieving this with the Sky CI processor. And just to bring up Roger again, I know Allie touched on Roger, but Phonak and AB for life. So Roger is the gold standard, and you see it often used in school systems, but there's a really interesting study that I'll show you by Jace Wolf. And this shows that at a steady 65 dB signal of speech, that as noise gets louder, patients who are not using Roger stopped hearing speech around 60 dB. So that's the gray bars. And if you look at the orange bars, these were patients using the Roger mics. They were able to understand some speech all the way out to 80 dB. So that would be like an insanely loud restaurant or a wedding or something like that. So Roger really is a truly adaptive, dynamic microphone. And we have demos in our booth as well if you'd like to listen. So Roger is useful at school, at work situations. A lot of patients say they use them at like a board meeting or a table. And then socially, a lot of patients like to use them at restaurants, weddings, things like that. And lastly, we're going to talk about our wireless connectivity. So it's not just Roger, right? Our devices work together between ears. So they're the only hearing aid and CI on the market that share technology between ears. And that makes a huge difference when we're talking about AutoSense and binaural processing. We spoke about Roger a bit, but what makes this unique in our system is that we have a wireless receiver code that can be installed on both the hearing aid and the CI, so that there's no extra attachments for the patients if they want to use Roger. Looking at the top left are Bluetooth Low Energy, which we graciously borrowed from Phonak and were able to implement into our CI. Allows audiologists to program the CI and the hearing aid in the same software, and it saves a ton of time. Some audiologists tell us it saves about 30 minutes per programming session. So that's huge. That same technology allows patients to use the AB Phonak remote mobile app. And so patients can make changes to both their CI programs and volume within the app. They can check their battery life. They can check to see if all their parts and pieces are working. So really easy to use. And then we also have Bluetooth Classic. So this is what we call our universal Bluetooth connectivity. So patients who have an iPhone, Android, Google phone, kids who want to connect to like a gaming system or a Surface tablet at school, any Bluetooth device can be paired with their cochlear implant system. And if they're bimodal with the Link hearing aid, it can pair to both ears. So they can stream phone calls, music, media, any audio signal from those devices. And then looking at the Airstream technology from Phonak, We're able to implement things like the TV connector and the partner mic into our CI system, and again, for bimodal users, they can have a bilateral signal. So we really fully integrate everything that's available for them wirelessly. There's no limitations, as you can see. All this is built in. So just to wrap up, the Sonova Advantage encompasses everything that Phonak and AB have to offer together. So we talked about our bimodal solution, the only dynamic coordinated bimodal solution on the market. It's using AutoSense to adjust automatically for the patient whatever noise situations that they tend to go in, automatically without making any changes on their app or with a button. We have universal Bluetooth connectivity for any device that they may want to pair to and stream from. We have Phonak accessories like Roger, TV connector, and partner mic, and so much more to come. So this is just a tidbit of what we've been able to do with Phonak so far, bringing hearing aid technology to cochlear implants, and we look forward to what's coming very soon. So stay tuned for our new innovations coming from Phonak and AB, and continue to connect your recipients with the moments they love. Thank you.